law, dementia care in Bermuda, social development and seniors, YouTube and CITV, as well as if you are on Facebook, you can drop your comment to our Minister of Social Development and
joining us as we embark upon persons with dementia. As our community, it's important that have the best chance. I want to say thank you, Dr. Cousins, Simpson, Ms. with us this evening. Related conditions are not alone. While we may not be in a place where we remain aware, so again, I want to thank you for joining us. Questions come up that I can assist with. The presentations again from Dr. Cousins Simpson.
of tonight's meeting. Back. Please keep your microphones muted, keep your cameras off. Just note that maybe your into us at askus@gov.bm. We're going to have three-part discussion. One question pool, and we hope our first speaker is going to be dementia certified. Speaker will be Marie Fay, occupation frustrations. Also the co-founder of Beams Bermuda, as well as a clinical
Thank you very much, Minister Ferbert, for and I think something that savvy. Let me see if Alicia. Tonight we're going to talk about very briefly Simpson, and I work at Bermuda Alzheimer's and Memory Services.
can see your screen.
Oh, okay. We're going to address what is dementia. So commonly, a lot of times, but you know, it's not confused term that is. So if someone loses comes to dementia or Alzheimer's, skills, what we call decisions. And this, for it to be termed enough to affect their daily brain. Type of dementia. So, and there are other types of dementia. So if someone has a function, it technically there are other types. There is dementia, and that can cause dementia too. Started having Alzheimer's, then types of dementia. As the tremors will eventually, that's a totally different type of dementia. There is the front, certain parts of someone's brain, mad cow disease, blood pressure. There are different types of dementia. Alzheimer's, however, is the most percent is has taken away all the spark. As the sixth leading cause, some people who rank it as the third. Sometimes I'll say why we're not sure if it's the sixth. So it's a pretty big deal. So not only do we have a large diabetic and will dementia or Alzheimer's. Speak in general with dementia is usually use in conversation. So they this person stopped by today and you said the executive one will come and ask and say, may I borrow $10,000? No, but now they're not. So they'll go to the or someone they're not used to. So they have impaired communication, where the money would come in, or just poor judgment. And they cannot remember the way back home. Progression, speaking and swallowing. Talk about a little bit is determined that news, because there was a time when we thought that, but that's not how it is. Prevent yourself from getting non-modifiable risk factor. You will get dementia. Cannot get it because we're actually seeing it in people. And we have to be specific with this. For the grandma, then they'll get it. That's not what this is talking. It disposes people to get dementia in their 30s or 40s. It's usually lifestyle related. A certain way, there's always dessert, there's always ice cream. Some of the family history where we see the predisposition, the genetic predisposition. There's also some disease where and you see that with all illness. It's because of our lifestyle, but there is. So they do find that ladies tend to get better, and then we just more stressed. There are things that we can do to that makes you have a higher. We'll give dementia in two ways. One, so remember we mentioned vascular dementia, but also smoking, just the top of the brain. So that so it increases your chances of getting usually uncontrolled high blood pressure. Your risk of getting, your chances of to get vascular dementia. Everybody can see. And with mini stroke, you get these. But over time, patients like these is that with the pinpoint each time the quite fine today or anything, but they and it they find that diabetes percent. It is really Alzheimer's that they're called. Diabetes is such comes to Alzheimer's or dementia. And these are things that we can fix. Size, make sure that we actually. The other is obesity. Exercise increases your. If I could put that in a pair, that increased your. You know, that's astounding. So it helps to prevent not only the other. Also mentioned worth the brain. So that's one of the low levels of formal education. Because manual labor, they tend not to. That is why they tend to. Depression causes dementia, or dementia causes depression. Injuries in the past, like likely to have dementia. Dementia as the vent. And what you do now, years down the road, problems in the brain, things that are with. Thank you.
Much, Dr. Cousins-Simpson. Now to our second speaker, which is Marie. Yes, we can see them.
Okay, good. And I work for the Action on Alzheimer's and Dementia Chair for individuals living with dementia. So thanks for the introduction. Is very unique and will differ depending on the type of process. So I know target and that it's very difficult to keep up with the changes. So caregiving challenges often associated with dementia, strategies that can aim for some best. So progressing to usual or unusual sometimes be unpredictable. Symptoms of dementia that are seen cognitive or non aggression, some BPSC in the disease process, their diagnosis of dementia. To appear as an time or their control over. For the vast majority of people that have symptoms, so more than 80% typically, dependent on the area of the brain that dementia, which affects the frontal and temporal difficult. Those are the issues that so condition, but also those that are attempting to care for placement for loved ones. So we've the first one we've got is wanderings. Increase over time as the disease environment as their home environment and may go loved ones that are familiar to them from maybe one reason for wandering. Sleep disturbance, typically that's termed sundowning, disturbances to sleep patterns. So it's very, and then having more lack some insight, especially in the early stages. So they can, particularly for personal care tasks, I think. Dressing, content, which may lead to accident, with cleanup and hygiene tasks within the home environment, which causes concern. So with regards to repetition, as decreased, be difficult for individuals to them over and over again. Questions repetitively or so as to express comes some frustration, physical aggression at times. Leads to some. And there's also some paranoid behavior. So as the changes there is a tendency for that so oftentimes into the home setting, a reality to the person who's living with the condition. I believe individuals can also, they may see or hear interacting with someone experiencing behavioral or psychological result of the disease process, sort of malicious or these experiences and that's living with dementia to educate ourselves about the and also to give us difficult or challenging scenarios, because it really is not so indicator of an unmet need or a method of communication. Language abilities may decline and they're not able to the individual is trying to tell us through their behavior. It could be that there's unmanaged or untreated experiencing and they're not able to tell us that they're in pain. In the environment, they may be fatigued, they may be bored, and can describe to me that they know something's not right. It could be that can contribute to confusion levels. Trigger behavior at times as well. Being their home environment or an inability to affect experience aphasia, understanding of what's being said to them can be. There can also be frustration. To get up and do what we want to do, that as the condition they want to do, when they want to do them without assistance. And also, most importantly, I put at the bottom there, caregiver approach. When you're interacting with somebody, their person, to better meet their specific needs that works for that person. Reduce escalations in behaviors, the functional decline, poor quality of life, and also caregiver. I wanted to put a slide in here about dementia versus delirium. Interacting with somebody who has a diagnosis, review, and that can be conducted by the or escalations to behavior may the dementia or escalations to behavior may the dementia itself. Simple as a urinary tract infection. Well, which is a and can last for hours or days. It's different. A gradual presentation and can allow the client. And in terms of medical symptoms associated with dementia, programs, therapies that stimulate the evidence, research evidence as effective in optimizing the medication available on the market currently. To specifically treat the symptoms of BPS. Stabilizers are sometimes used anxiety, aggression, and agitation. Treating BPSD that it treatment strategy while we who will share some practical caregiving strategies.
Maxine, are you able to unmute?
Good evening. As co-founder of Beams at the Bermuda College as well. So I do dementia patient. Maria and I behaviors. She taught a lot of them. I am simple ways. So I will be brief. Family members can use as tool to wandering and dangerous behavior. Individual with in familiar surrounding. It's safe to live alone or to travel alone. Do firstly is to escape all baby monitors are helpful in keeping want to go out alone. Next. Maurice, in more than one of her slides indicate and dementia patient of the disease, maintain regular sleep, alcoholic and caffeinated sleep. Make sure free. Indicate any source of pain. Next. To patient. Yeah. However, due to and problem solve, it is called such as in weight gain or weight links with sleeplessness, urinary tract infection, and nutrition. Guarding mealtime. Meat that are visible. Very important. And family members of demented individuals. Bathing. Most demented thus have Ensure that the area is safe and grab bars are just appropriate water temperature. Being naked or being able to some females who does that need to be incontinence. This occurs and defecation. In the event of an accident, make the bathroom easy 2 hours before bedtime. Establish consistent. Next, so highlighted in movement can be first. Try diverting music, reassure them. Next, frontal temporal dementia. The brain are in attention, judgment, planning, and self. Personal. Next. And privacy can be their lack of sexual disability. They'll try to have sex anywhere. Hallucination. Hallucination, as said previously, things that are not present. False nature. Delusion involves of those around them as all in others. And please know that whatever they are saying or things like anger, unmet needs. React calmly. Yes, the unmet needs. Distract in a positive manner. Marie indicated, behavior and implement intervention, chemical or physical, and an understanding of the reality to feel safe and understood. Kind gesture, such as holding are still your loved one, your neighbor, or even your school. Instead, next, by preserving their memories, living with dementia of one, they have stories. All that they have, as well as create new memories if possible. Thank you.
We had questions come in. Us at gov.be. First question that we have. Some insurance companies dementia. Can the government assist? We're going to go.
Surely a concern of many, not affordable for some, and to work towards making this affordable. Consider future planning and also putting responsibility back. Still looking at the Bermuda. There is a consideration for the A+. Of a benefit will be there for
Okay, thank you for that. Question in the chat. Need to ask for them, what should they or
Do you want me? So it raises that the individual living that has passed, and they're concerned about providing the information over and over again, as it may be distressing for that person. For some people, they appreciate the information. Stress. And in those circumstances, I would say that it is that topic of conversation if possible. Or time spent with the loved one. Be my suggestion.
Maxine, did you have anything?
Focus on the distraction part. And
What educational resources are available? Are there training members and caregivers about dementia?
can I say something?
Yes, please.
Okay. Actually have educators who as well to give them educational sessions. Educational sessions that were planned. Also, they do have information that they share with family members.
Sentiments of resources online, and again, there were some they've had to be delayed, but this will be something that we and support going forward.
The members, a lot of times it's how should I put this, wrapping their head around what's happening. They need some but a lot of people can go on Google if all they want. You know, if we access a lot of these supports that support, so it's more of a support system.
How do you get a family the assessment, perhaps due to fear or stigma?
I see that a lot. One of the ways we do it is I kind of enter as a GP doing a checkup. Like if you have a husband and wife, you can do an assessment for both. But it's a lot of fear for the person.
Quite a few questions coming in about support groups for caregivers.
So the charity that I work for, Action on Alzheimer's and on the website, which I believe Sarah D'Alessio just shared
In the chat,
on the chat. Because of the COVID restrictions, but typically we would be those that are caring for a loved one with dementia at home and feeling those that are caring for a loved one with dementia at home and feeling like they are on their own.
Okay, so if anyone has, welcome you to email them to us at joined in, whether you're on. We are going to take discussion helpful. It's going to answers. Yes, no, somewhat, or if it could be better. And then moving forward, we can go ahead and make votes. Okay, so look you to join our next p.m. to 7 p.m. We'll be going into resources online, hiring in-home help, some protection and welfare, as well as we will be launching. So it will be on Magic 102 with Mr. Glenn Blakeney at 3 February and July. 5th, we'll go more in depth of what is Thursday, May 27th, we'll be handling trouble. Wandering and a ongoing campaign, and we laundering and living. It's an ongoing campaign, and we really are seeking to engage collectively the responsibility of enhancing the quality of life. To join us at the please follow us on social media. Didn't have time to answer today. Email, how we can answer. Also, let everyone who is on recording of this. So what and have a great night until the next.
Sort of worn, but you know.
She's made from the